So thanks everyone for inviting me along. I just wanted to give a little bit of context and talk for a few minutes on the importance of suicide in men. I mean, it remains a really important issue. So we know, based on the national data in 2018 and 2019, unfortunately, suicide rates went up. Suicide is still 3 times more common in men than women. So, you know, that's been a constant really over the past several decades. And it's important really that we focus on what we do for that particular group of individuals. And one of the groups we're particularly concerned about at the moment is men in midlife, so men in middle age, essentially. There's a big evidence base. There's a big evidence base about what we might do for people in mental health service contact, what we might do for people who hurt themselves, so people who are self-harmed. But one of the priority groups that we haven't got a huge amount of evidence for is men, actually. And as part of our work, we go around the country, we are working with individual areas, doing quality improvement work. And that's a real evidence gap, if you like. And that's why projects like HOPE are so important, because they're helping to plug that gap. It's an evidence gap, but it's also a service gap. You know, how do we reach men? How do we reach men in midlife who are at high risk of suicide and who might not go to conventional services? So they might not be in touch with their general practitioners. They might not be in touch with mental health services. How do we reach them? And that's why these initiatives are so important. So I know there's been lots of interest from colleagues around the country about, you know, exactly what you do with HOPE, and the idea that first of all it's timely. You know, it's timely, near, immediate is a really important one, because we know that the period of highest risk is that period early on. So if someone has a crisis, someone's hurt themselves, getting in there quickly is so important. So that I think is really important. And the other bit of HOPE I think that's particularly valuable is its focus on, you know, the practical and the real world. So quite often, you know, when we're doing research, you know, sometimes it can be a bit theoretical. Sometimes, you know, we struggle to translate that into practice. But things like HOPE are based very much in the real world, real problems, and what we can practically do to help. So it's a really important way of filling that gap, both in terms of service provision, but also the evidence. The other thing we need to be aware of going forward is the effects of the ongoing pandemic on people's mental health, on people's suicide risk. And the evidence today is that the pandemic has had impacts on people's mental health. People won't be surprised to hear that. But so far that hasn't translated into higher suicide rates, which is good news. But we are still relatively early on in all this, and the consequences, particularly the economic consequences, may be yet to come, and HOPE hones in on those factors. And so I think that could be really beneficial going forward. So things like, you know, the effects of the pandemic on employment, on debt, on housing, you know, is likely to be, I think, the big story of this going forward. So anything we can do to mitigate those effects, I think, will be particularly helpful going forward. So I'm very happy to be learning about your work, to be supporting you in your work, and I wish the HOPE project all the best going forward.